Everybody is somebody, right? So everybody comes in as a patient, they're somebody, they have a family. My dad always said everybody is somebody. My name is Shawn LyBarger. I'm a GYN oncologist, new to Arizona, but I've been practicing in Kansas City for a little over 11 years, and I was on the East Coast before that. I am very passionate about advanced ovarian, advanced uterine, and advanced cervix. So we treat female cancers. If you have a breast cancer, you would have a medical oncologist, you'd have a surgeon that does the surgery, and then you'd have kind of some in-between doctors. We're unique in that we do it all. So we do the big advanced cancer surgeries, and then we also do our own chemotherapy. So we have a kind of all-in-one scenario, which I feel is better than going to like 6 different doctors. So I'm unique in that I do almost everything robotically. My patients go home the same day from surgery. So my concept is you get to go home quicker, less pain, less nausea, and you recover faster. Nobody wants to be in a hospital more than they have to. So when you can do these big cancer surgeries through 5 small incisions, and they get to go home the same day, and on minimal, if any, pain medicine, that's a significant benefit. Gynecological cancers today are evolving. We can actually tailor their treatment to their markers so that they're not just on a blank carte blanche chemotherapy algorithm. We can add different medicines to help them target their actual cancer. I'm also really big in the clinical trial aspect. I've built several trial centers around the country, so here I'm trying to build a clinical trial center for some of the more advanced cancers to be able to provide better drugs and better medicines and therapies to help people live longer. I had a patient in Kansas City, horrible ovarian cancer. The imaging just had tumor and cancer everywhere, and we come up with a plan. We did a big surgery. She was in the hospital. I told her she'd be in the hospital for 10 days, and she said, I'm going home in 3, and she went home in 3. And she did treatment, the first-line therapy. She did amazing. I put her on a clinical trial, and she was the longest patient survived on that clinical trial in the world. She said she was our unicorn, so she would always bring us unicorn everything. We had thermoses and stethoscopes and pens. I was very proud of that because she lived longer, a decade longer than she probably would have otherwise. I'm excited to join Advanced Women's Care because this is a new practice. They have a huge population of patients in Phoenix, and it's a significantly underserved area. I was actually looking all over the country to find a place to go, and I liked this area because there's so many people that are not being adequately treated for cancer, and that's really what my passion is going to be.